Hi there, AccentCare. Hello, hello.
Hello, this is AccentCare.
Hi, how are you? Good morning.
Good morning. We're doing great. Is this Terry?
It is.
Good morning. How are you?
Good morning. Really well, thank you. Just a quick question. Are you all going to be using your own computer through the webinar?
We certainly, we are set up. Yeah, we're set up for that. However,
Okay.
can make changes if we need to.
Oh, no worries. I just wanted to make sure that you guys are good with the audio and I can switch over to you all once I do the introduction. So we'll do that and then I'll hand it off and then you guys can take it away and then we'll do Q&A at the end. So I'm glad that you all are on and able to hear, and then we'll switch over the controls here shortly. I'll probably start around 11:05 or between 11:03 to 11:05. Go ahead.
Okay, and so for me, presenting the content, I'll just need to speak into the phone, right?
Correct. Are you able to click through the slideshow on your end as well? Because I was going to switch it over so that you guys can do that, and that way your audio and visual would match. If not, I can click through the slideshow too, and I have the latest version. So whatever you all want to do, I'm down to roll with it anyway.
Okay. Do you want to just advance it? Or?
Yeah.
Yeah, we'll advance it on our end. Thank you for asking.
Yeah, of course. Let's see. That sounds good.
I noticed my picture didn't make it up on the panelist screen, but that's okay.
Oh, sorry. Well, I think the guests are arriving here. So good morning, everyone. This is Terry Torres, and we have our wonderful friends with Accent team here as well. We're going to get started here in a few moments. I'll do the introduction and then hand it over to our wonderful panelists so that they can share with you all about late life depression. So we appreciate your attendance and your patience while we wait for the rest of the guests to arrive. Thank you.
I can hang that up, but I don't want to take a chance and just get it.
Hello, everyone. Good morning again. This is Terry Torres with the Gardens Group, and I so appreciate your time today. We're going to be talking all about late life depression, brought to you by our professional partners, AccentCare Home Health. I wanted to go ahead and do a brief introduction of our guests, and then I will let them definitely take control and educate us all on this very important topic, especially now more so than ever, while we are all facing the challenges of COVID-19 and kind of figuring out all of this together, right, as a nation and globally as well. We know that in crisis, the populations that are affected most are certainly seniors, and that's all of our specialties, especially, those with memory impairment, and it's just so key to have our mental health all taken care of and really well appointed during this time. And, according to the National Alliance on Mental Health, depression affects more than 6.5 million of the 35 million Americans that are 65 years and older. We've collaborated with the AccentCare team today to provide you this webinar to give you insight and identify different treatments and for late life depression. And there's no better partner to present this to you than AccentCare. AccentCare does provide a wider range of post-acute healthcare services, ranging from personal, non-medical care to skilled nursing, rehabilitation, hospice care, management, and of course, home health. Today we have Denise Bussinger, and she's a nurse navigator for AccentCare Home Health. She manages the educational department and provides current education and in-service to the community partners for staff, residents, and families. Denise is passionate about learning, and she enjoys the privilege of teaching others, creating meaningful engagement, and witnessing all of the aha moments. Certainly, we're going to have those today, while she supports teams to learn and grow through new information and open dialogue. Denise has experience that spans over 28 years, which includes 15 years of working closely with geriatric patients who have also, have comorbidity conditions and complex etiologies. Her passion is fueled to introduce meaningful connections and commitment to partnership within the community, driving forth every single day. We also have another great partner here from Accent Health. They're partnering on this presentation today, which is excellent to hear from experts in the field. We have Steve Wen, who's a behavioral health nurse for AccentCare Home Health. He's been with the company for over a year, and in the behavioral health field for 4 years. And specialty is working with residents with depression, dementia, anxiety, schizophrenia, and bipolar, working closely with depression to find ways to assist people with dementia and who are struggling, but Steve is able to create therapeutic settings and interventions to help with their daily lives. Other duties include providing in-service education, a perfect partner for today, certainly, on behavioral health. Steve is passionate and dedicated to behavioral health field, and his goal is to continue with education and become a nurse practitioner and continue to provide the best possible care to patients and family members. So once again, really excited to bring you this topic. And without further ado, I am going to turn it over to our panelists here so that they can, educate you all further on this topic. And then we'll, if we have time, definitely open to take questions at the end to provide this information to you. So let's see here. And AccentCare, you are now the presenter. Let's see, want to make sure that you are not muted, and you can go ahead and share the screen and take it away.
All right, thank you very much. Good morning, everyone. Thank you for joining us today. I am Denise Bussinger, Nurse Navigator for AccentCare Home Health, and I am joined by Steve Wen, Registered Nurse, specializing in behavioral health. And together with all of you, we will be talking about late life depression, who it affects, what the symptoms are, how to treat it, and much more. I would also like to ask, as Jennifer has, that you might write down your questions so that we can address them at the end of the presentation. What is late life depression and who experiences it? All people experience sad feelings at one time or another. However, if you or someone you know has a persistent sad mood, loss of interest, or difficulty functioning either day-to-day activities or in relationships for more than 2 weeks, you may have clinical depression. When clinical depression occurs for the first time in people 65 years or older, it is known as late life depression. Depression can occur at any age in life, but late life depression occurs in people over the age of 65. Depression is not a normal part of growing older. It's a treatable medical disease, much like heart disease or diabetes. Late life depression is a serious illness affecting approximately 15 out of every 100 adults over the age of 65 in the United States. Sadness associated with normal grief or everyday blues is different from depression. A sad or grieving person can continue to carry on with regular activities. The depressed person suffers from symptoms that interfere with his or her ability to function normally for a prolonged period of time. Recognizing depression in the elderly is not always easy. It's often difficult for the depressed elder to describe how he or she is feeling. In addition, the current population of older Americans came of an age at a time when depression was not understood to be a biological disorder and medical illness. Therefore, some elderly fear being labeled as crazy or worry that their illnesses will be seen as a character weakness. The depressed person or their family members may think that a change in mood or behavior is simply a passing mood, and the person should just snap out of it. But someone suffering from depression cannot just get over it. Depression is a medical illness that must be diagnosed and treated by trained professionals. Untreated depression may last for months or even years, severely affecting the person's quality of life. What may trigger late life depression? Life situations such as loss of a spouse, loved one, or a friend, a recent diagnosis of an illness, declining health, changes in living arrangement, inability to care for self, social isolation. Chronic or serious illness is one of the most common causes of depression in the elderly. But even when someone is struggling with a chronic illness such as arthritis, it is not natural to be depressed. Remember, depression is defined as an illness if it lasts 2 weeks or more, and if it affects one's ability to lead a normal life. Many factors can contribute to the development of depression. Often people describe one specific event that triggered their depression, such as the death of a partner or a loved one, or the loss of a job through layoff or retirement. What seems like a normal period of sadness or grief may lead to prolonged, intense grief that requires medical attention. The loss of a lifelong partner or a friend is a frequent occurrence in later life. It is normal to grieve after such a loss, but it may be depression rather than bereavement if the grief persists or is accompanied by any of the following symptoms: guilt, unconnected with the loved one's death, thoughts of one's own death, persistent feelings of worthlessness, inability to function at one's usual level, difficulty sleeping, and weight loss. If any of these symptoms are triggered by a loss, talk to your doctor about your feelings. One important sign of depression is when people withdraw from their regular social activities. Rather than explaining their symptoms as a medical illness, often depressed persons will give different explanations such as, I don't feel well enough, or I'd rather just stay in. I don't have the energy, or I'm feeling tired. For the same reasons, people with late life depression often neglect their personal appearance or may begin eating less. Like many illnesses, there are varying levels of depression. A person may not feel sad about anything identifiable, but may exhibit symptoms such as difficulty sleeping, weight loss, irritability, or physical pain with no apparent explanation. Depression affects your ability to perform tasks, to communicate, and to think clearly. So what are the symptoms of late life depression? Appetite changes, sleep issues, too much or not enough, nervousness, and anxiety or irritability, slowing down, loss of energy, negative feelings, reduced ability to think, and repeated thoughts of death or suicide. Do any of these symptoms describe you or someone that you know? Let's take a look at a few more. Persistent sadness lasting 2 weeks or more. Excessive worries about finances and health problems. Frequent tearfulness. Feeling worthless or helpless. Weight changes. Pacing and fidgeting. Difficulty concentrating and physical symptoms such as pain or gastrointestinal problems, such as stomach upset, nausea, diminished appetite, diarrhea, or constipation. It is also important to know that sometimes depression will occur for no apparent reason. In other words, nothing necessarily needs to happen in one's life for depression to occur. This can be because depression can also be caused by biological changes in the brain. However, in older adults, there usually are understandable reasons for the depression. As the brain and body age, a number of natural biochemical changes begin to take place. Changes that occur as of the result of aging, medical illnesses, or genetics can put the older adult at greater risk for developing late life depression. Now, let's explore some of the factors that correlate with depression. They are reduced ability to perform daily activities independently, reduced satisfaction with life, lowered economic standards and income, lack of social support, pain, and fatigue. Because of its devastating consequences, late life depression is an important health problem that must be addressed, and it is associated with an increased risk of morbidity, increased risk of suicide, decreased physical, cognitive, and social functioning, and greater self-neglect. For all of these reasons, it is important to identify late life depression as early as possible to prevent further decline and improve one's quality of life. So now that we have taken a look at late life depression, its triggers and symptoms, let's take a closer look at its effects on health. Depression advances biological aging by causing inflammatory changes to the brain and other parts of the body. Depression also causes the brain to shrink. The amount that these areas shrink is linked to the severity and length of the depressive episode lasts. Other areas of health that are affected by depression are obesity, diabetes, frailty, disabilities, cancer, coronary artery disease, cerebrovascular disease, cognitive impairment, and Alzheimer's disease. Conversely, the diseases that are complicated and intensified by depression are cerebrovascular disease, coronary artery disease, as well as diseases of the basal ganglia, which is the part of the brain that controls cognition and emotion. These types of diseases include, but are not limited to, Parkinson's disease, progressive supranuclear palsy, and Huntington's disease. Depression also complicates dementing disorders such as vascular dementia and Alzheimer's disease, cancer, pancreatic and lymphoma and other types, autoimmune diseases, and endocrine diseases. All of the above mentioned diseases affect depression, and depression affects all of these diseases. Isn't this interesting? We often think of depression as a singular condition to be treated. But as we can see here, depression and disease can easily go hand in hand, resulting in negative health and decline. Which makes the important point that depression needs to be treated as soon as possible, so that the affected person has a greater chance of maintaining better health overall. Now let's talk about some common myths associated with late life depression. Myth number 1, most older people are depressed. The way I'm feeling is normal. While a short period, hours or days of sadness may occur in older people, depression lasting weeks or months only occurs in a small percentage and is not a normal part of aging. Myth number 2. Of course I'm depressed. Wouldn't you be if you were sick or disabled? Although older people with chronic illness and disability are more likely to be depressed, depression is not something that you must accept as part of your illness. The good news is that both ill people and well people may be treated for depression. Myth number 3. I can pull myself or my spouse out of it. People can often overcome brief periods of low mood or sadness on their own. However, clinical depression or major depression requires professional help. Myth number 4. I'm too old to change. Studies have shown that depression is treatable in over 82% of patients with late life depression, and the likelihood of responding to treatment does not appear to decrease with age. That's very good news. Myth number 5. The last thing I need is another pill. Treatment of depression can actually decrease physical symptoms and may reduce overall medication use. Many antidepressant medications can be taken as a single pill, once per day. Your doctor can determine the best treatment options for you. Myth number 6. I can't get treatment for depression right now. I have to focus on getting better from my medical problem. As we saw earlier, depression may intensify other illnesses such as heart disease and stroke. If you are depressed and physically ill, one of the most important parts of getting better is getting help for your depression. And lastly, myth number 7. I don't have time to deal with depression because I need all my energy to care for my spouse or parent or child. If you are depressed, you need to get better first in order to care for your loved one. Now let's talk about the prevalence of late life depression. Here we can see that depressive symptoms occur less frequently in community residents and in hospital settings, and more frequently in chronically ill primary care outpatient settings and in cognitively intact nursing home patients. Major depression occurs less frequently in community residents, but steadily increases in chronically ill primary care outpatient settings, hospital, and nursing homes with cognitively intact patients. Let's turn our attention now to some very good news. AccentCare's Right Path program for late life depression. Right Path is a step-by-step plan based on expert clinical guidelines, your doctor's orders, and your personal needs. The right formula for your depression delivered to you, wherever you call home. By managing depression, good health is maximized. This is done by providing you with the right formula of skill, support, and service. We are committed to providing you with an experienced team for the best possible care. Our behavioral health nursing program utilizes highly trained nurses who specialize in depression management, with an emphasis on cognitive behavior therapy, problem-solving therapy, and support therapy. We support you by providing the right amount of help for better day-to-day health through medication education, self-care management strategies, psychological counseling, and grief therapy. Our nurses are caring and will provide you with special attention to meet your personal needs through a customizable care plan for symptom management and frequent communication with you, your family, and your doctor. Our Right Path program is covered 100% by Medicare. This means no deductible, no copays, and no minimum number of visits. This guarantees that you will receive the right amount of care and services that you need in just the right amount of time at no cost to you. Fewer symptoms, fuller life. The goal of our late life depression management program, Right Path, are to improve and maintain the patient's maximum functioning, to support the patient's caregiver and their families, to enhance the patient's self-esteem and personal integrity, to provide for a patient's medical needs, to maintain activities of daily living, to educate patients and caregivers as required by their needs, to provide care that minimizes fragmentation and that emphasizes continuity of care. Lastly, we aim to teach and maintain compliance to medication regimen. With depression and anxiety on the rise, especially in the wake of COVID-19, we are prepared and committed to making a difference in the lives of you or someone that you know. With the ability to not only improve, but to reduce depression symptoms by over 82% and reduce anxiety symptoms by 80% plus, confirms that your late life depression care is certainly in the hands of the right professionals. In summary, let's briefly review what we have talked about today. Late life depression occurs in persons 65 years and older and lasts for more than a few hours or days. Late life depression affects one's ability to function normally and to think clearly and interrupts one's quality of life. Although late life depression can occur from biochemical brain changes that occur as people age, it can also be brought on by situations in life. Risk factors for late life depression include other illnesses, experiencing loss, loneliness, social isolation, and disability. Symptoms include, but are not limited to, appetite changes, sleep issues, anxiety, irritability, weight changes, and a reduced ability to think and concentrate. Late life depression's effect on health is well known to complicate other diseases such as heart disease, Alzheimer's disease, and diabetes, just to name a few. Myths. Myths are unreasonable beliefs that can impair your health and delay treatment. You owe it to yourself or a loved one or friend to embrace the symptoms of late life depression so that you may experience a fuller life now. The prevalence of late life depression is on the rise. Although depression occurs more frequently in younger adults, older adults are also susceptible to depression and overall decline, leading to a lowered quality of life. Hope. Hope is the goal of AccentCare and their specialized team of professionals to reach those in need who are suffering from late life depression. Our caring team can truly make a difference in the lives of you or someone that you know, thereby improving health, a positive outlook, and a better tomorrow. Help is available, and we are all in this together. And together, we can improve health, keep people safe, and improve one's quality of life. Hope is on its way. As we bring our discussion about late life depression today to a close, I would like to create a picture of what life after late life depression can look like. Will you please join me for a minute so that we can take a closer look together? A person who overcomes the debilitating effects of late life depression can have a stronger sense of connection, enjoy the company of others, feel less pain and fatigue, have healthier eating habits, experience less disease aggravation, will have clearer thinking, will spend more time looking forward to life events, have a stronger sense of well-being and self-acceptance, and can feel hopeful again. I can't think of one person who would prefer to feel differently than this. Can you? AccentCare is here to help, a professional friend in your time of need. At this time, I would like to open up the next few minutes of this presentation and invite Steve Wynn, our very own behavioral health nurse, to join us to answer any questions that you may have. Ladies and gentlemen, Steve Wynn.
Good morning, everybody. My name is Steve Wynn. I'm the behavioral health nurse that's working in Orange County, North and South County, working with late life depression. I'm here to take any questions or comments.
Do we have our first question for Steve?
Don't have any questions yet. This is Terry from the audience. However, I had a question. How can our attendees or anyone out there get in touch with you all? What's the best way to learn more about AccentCare?
Okay, if there are no questions, then this concludes our presentation on late life depression. This presentation was brought to you by AccentCare Home Health, and we're located in Newport Beach, California. And we're the only home health agency in Orange County who offers the Right Path program. For more information, we can be reached toll-free at 800-249 Were you able to get that information?
If you could give the phone number and the web address one more time.
Sure. The phone number is 800-249-9300. and we are at AccentCare.com.
Perfect. I thank you so much, Denise, Steve, and then also we have Lorelei, representative from AccentCare. Wonderful partners. We really advocate for their services, so definitely reach out to them directly to find out more. And also, you can reach out to any senior lifestyle community where we do partner with AccentCare by going to www.seniorlifestyle.com to find the local community that would work best to service your loved ones' needs for senior housing. So I thank you all again for this great presentation, all of the wonderful information, and thank you to the guests for joining us today. We thank you so much, and hope you all have a great, safe day. Take care.
And Terry, I would like to thank everyone as well. Thank you all for taking the time to join us today and to learn more about late life depression and how it's treated. It's been our pleasure to spend this time with you, and we hope to see you again to serve you and any of your behavioral health needs that may arise. Please consider AccentCare Home Health your partner for positive outcomes and good health. Thank you.